In my view, and this is tactical, I may be wrong about this. The way I look at it, the only reasonable way and prospect we have to be able to get general national health insurance, affordable health insurance, is in 3 stages. I know, by the way, John Edwards has a decent plan. It's just not a wacko plan. It's pretty solid. But the problem with, I disagree with some parts of it, but the problem of being able to think we're going to be able to, in a single vote, move $1.9 trillion of the economy from here to here, it ain't going to happen. It's not going to happen. So even though it's desirable to happen. So here's what I think the way we get to it, and I'd really appreciate as a doc your view on this. I think we can immediately start off by taking what I hope to be an Iraq dividend here, insuring everyone under 18 and catastrophic health insurance. I think you could sell that, you could get it done, you could pay for it, it would be consequential, it would drive down premiums that companies are now paying for employers rather than have them, give them the excuse to drop them, make them a little more competitive, and allow the self-insured to have a better shot at a lower premium to get health insurance.
Drug companies ought to be constrained.
No, by the way, the vote we're going to have on Wednesday will be decided by a single vote. I had to cancel everything I was supposed to be doing in Iowa because I'm afraid to miss it. Is a vote that the Democrats have put in the bill requiring the Secretary of Health and Human Services to negotiate with the drug companies on drug prices.
That'd be nice for a change.
There'd be gigantic change.
Yeah.
But it's not the answer. It's a step. The second thing I think that would be I could do almost close to, not literally, but by executive order, would be to require electronic data keeping in all medical records, which
but he's computer illiterate.
No, but no. By the way, so am I, relatively speaking, compared to my granddaughter. I am.
Yeah.
But look, here's my point. All of the people, all the experts out there say that could save from 10 to 30. I think it's closer to 10% of the overall cost, hospitals and the rest. But I think the thing that will get us to total health coverage, health insurance for everybody the quickest, is to do what we did on welfare reform. What we did was we allowed the states considerable flexibility and leeway in reorganizing their system, and we underwrote the cost to the poor states in doing it to get work programs going. Do the same exact thing with health care. You have now a dozen states, including big ones, that are now passing legislation requiring universal insurance, just like liability insurance. Okay. Once you get to a critical mass of 30 to 35 states, you've established a national consensus, and then go cherry pick those elements of the plan. Maybe even give them more localized flavor rather than one simple standard that exists, but require that there be total, complete coverage across the board of every American. And I think that's the way to get to this. The one thing that Hillary and I agree on is that she and I are the only two out there saying it's going to take an administration to get it done. The others are out telling you, we're going to pass this, I'll be the president, will pass it. Well, unless there's a second coming, I'm not sure how that happens quickly.